PLAB 2 is a pretty stressful and expensive exam, and it's definitely the type of exam that you want to be one and done. When I had to take it, I was I was racked with anxiety. I was just like, I'm not really sure what's going to happen when I go in there. I'm not really sure how I'd feel when I leave. And I know I'm not alone. I know there are a lot of us out there who feel exactly the same way. So I thought I'd put together some tips about what I felt on reflection I could have done better or could go better, and what other people have told me, and other things that I feel are just things that you can avoid in order to ensure you pass your exam. If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe. Hey guys, my name's Ibreez, and I currently work as a doctor in the NHS. And PLAB 2 is an exam that is an OSCE-based exam. So you're seeing patients, you've got to do this whole simulated station stuff. Now, I don't want to go into the intricacies of what the PLAB 2 exam is in this video because we already have a video on that. But what I will talk about here are some of the tips that I feel are important for us to remember when we take our PLAB 2 exam. And some of these are things that I implemented, and I really believe that's what helped me do well in my PLAB exam. So let's get into it. The first tip I want to impart to all of you all is do not memorize a script. Look, no offense to any academies out there that are repping a script, but y'all, don't memorize it. It'll come off as so stale. Just think for a second. Like right now, I'm doing this video, I'm talking to you extempore, we're having a conversation. If I was reading a script, it would be so robotic, and you wouldn't want to listen to me, and I wouldn't want to listen to me, and that's the way it is. So if you are provided with some form of a script, it's for you to get a general idea of maybe of what the station is and what kind of patients you might be having, but really do not memorize a script. And if you feel like that the way that you're being told to practice or your mocks are fully reliant on a script, I would be very hesitant to practice in that way, because you will come across as really wooden, really rigid, and really unapproachable in your exam. The second tip is really a follow-up to the first one. Remember, you're a doctor. See, doctors don't need a script. I mean, I really hope you're not using a script. How would you be using a script if you're in your hospital setting or in a clinic setting? So think about it. You are being told to imagine that you're an FY2 or whatever in a GP clinic or in a hospital or an emergency department. So remember, if you're in a situation where you're like, I do not know what to do next, go into doctor mode. What would you do in real life? And that's how you should be proceeding really with all of your stations. If the patient's telling you they've got some pain somewhere, or they're telling you about some other complaint or something else that you need to fix, what would you do in real life? Don't try and think back, oh man, what was on that script? That's why you shouldn't be memorizing a script, because a script is not real life. Take it as real life. There's a real person in front of you, or you're holding some sort of a conversation over the phone, or you've got a simman. Whatever it is, you have to interact. And what you have to do with interacting is being natural, being a doctor, and treating your patient. The third tip is stay calm. And I know it's so easy for me to say that. You're like, ugh, Ibreez, you're saying stay calm. Do you realize how much time and effort I'm putting on this exam? I've come from far away. I've had to pay a visa fee, a flight, an exam fee, all of this. You're telling me to stay calm? Look, yeah, it is easier said than done, but it's a really important thing to remember, because a lot of what happens in the exam is right here. We overthink everything that's happening. So if you think the last station didn't go very well, or if you are bringing the last station into your next station, you're not going to be able to perform very well. Remember, the minute you close that door to that station and you've moved on to the next one, that's it. That station's done. You will not think about that station anymore, and you will think about the new station. You will concentrate on the new station, and that's how it should be for every single station that you have. When you're at your rest stations, do you know what you're going to be doing? You're going to be taking a break. You're going to be sipping some water or whatever, biscuits, crackers, whatever they've offered there for you to have, and you will relax. You'll take a couple of deep breaths. You'll think about nice, calming things, what you're going to be doing after the exam. You will not be mulling over in your head what happened in those other stations, and you will not be stressed out about what the stations are in front of you. You will use that rest period to do exactly what you need to do, and that's recompose yourself. You forget sometimes in an exam how easy it is to get dehydrated, to get hypoglycemic, to freak out. So I think those rest stations are really important. You get 2 of them, use them wisely, take your break there, and just close your eyes if you have to, take a couple of deep breaths, and just disconnect from the exam, and then reconnect the minute you have your next station. The 4th tip is do not use phrases you are unfamiliar with. So in a lot of academies or when people are practicing, they tell people to use colloquialisms that it'll come across as more genial or I don't really know what. So don't do that. Like if you're not normally using words like duck or love or whatever words that they're telling you to use as terms of endearment, don't use them. It'll come across as so stale because it'll roll off of your tongue weird because you never use this. I mean, I've never called anyone a duck. The only time I say duck is if I'm talking about a duck. And I get that in the UK there are people who use duck as a term of endearment. But if you're not used to doing that, don't force it for the sake of this exam. Whatever you're used to doing normally when you see a patient, if somebody tells you something, you're like, oh no, you feel bad, or you want to empathize, or just in general, you want to give some term of an endearment if you feel it's appropriate, then use what you already use normally. And again, don't try and push it that you have to use it every 5 seconds. Like, oh, how are you, love? Do you feel okay, love? Any pain, love? Where's the pain, love? They don't need to hear it 16 billion times. They get it. You're trying to be nice. Sometimes we start overcompensating by using these phrases because we think we need to sound more British or we need to sound like we're locals. Y'all don't need to. You've already proven you can speak English. You've passed the English proficiency exams. You don't need to go into this exam by, putting on an accent or using phrases that you're not used to using or saying words or using colloquialisms that you're not familiar with. The more you take this approach as something that you do on a day-to-day basis, the easier it will be for you to pass this exam. If you start cramming into your head the extra things that you think you need to be saying or how you need to be acting, not only will it not come across as natural, but you'll be stressing over the wrong things. You'll start wondering, oh, do I call it tea? Do I call it dinner? Should I be calling this one duck or this one love? Should I be saying, this? Should I be saying that? Don't do that. This is the wrong thing to stress yourself out about. So again, whatever you have to do when you're seeing a patient, be natural about it and stay natural in your approach. Don't force it. The 5th tip, the last tip, the most important tip, and you're going to be like, Ibreez, this is so obvious, but honestly, practice, practice, practice. Even if it's you in front of a mirror talking to yourself day in, day out, do it. You need to see what your facial expressions are. You need to see how you're reacting. You need to remember when you should be speaking in a particular way. And practicing with others is the best form, the best way you can do this. Now, it may be difficult for you to practice with others because maybe you don't know anyone who's taking the exam. Maybe in your academy, everyone's already grouped up and you're the lone person out. Look around in different Facebook groups, see if there are other people who are in your same situation. Even if you guys do this over Zoom or some other form of, media, that's fine. You don't have to necessarily be doing it face to face. And remember, what they're judging you on is 3 domains, okay? They're checking your data gathering, they're checking your management skills, they're seeing about you and your clinical approach. What are you doing when you're actually seeing the patient, and what are you thinking about, and how you're processing and how you're communicating. So don't think that you always have to have the answer, that you always need to know exactly what the diagnosis is. If you keep these 3 domains in mind, you're golden, all right? Just remember, that's what you have to at least try and attain within the time period that they've allocated for you. If you finish early, it's okay. Just sit there and wait it out. If you finish right at the bell, that's okay too. Don't stress yourself out about something so unnecessary as, oh, what if I finished 3 minutes earlier than everyone else? Because you have to remember, the way that this exam is set up, you don't know what the passing score is the day you turn up. In fact, nobody does. Everyone's performance is being judged on the basis of these domains. They will see what the general average is, and they put it through all this, fancy calculations, and they put off what is the general cutoff, what is the general passing on today's exam basis. So what may have been the passing mark yesterday won't necessarily be the passing mark today because different people turned up to the exam and they performed differently. Do not get caught up with, oh man, what if there's a new station? What if there's a station I haven't heard of? What if there's something this, something like that? No. Whatever you're practicing to do is you're practicing how you need to be approaching your patient as a doctor in the UK. And that's
all. It's not about having the perfect response. It's not about having the perfect management. It's about going through whatever the patient is telling you and responding appropriately, because that's what you do in your daily practice. That's what you're already doing as a doctor. It's nothing new. The only extra thing that happens is, yeah, fine, you're in the NHS, you're doing it in the UK. You might have a little bit of stress because you're wondering about how fluent you are. You might be wondering, am I doing this exactly right? And that's completely understandable. But don't think to yourself that it's impossible, all right? If you practice, it's totally possible. And remember, at the end of the day, it doesn't matter what score you got in this exam. It just matters that you passed. And that's what you're going to do. You're going to pass. So the main takeaway, guys, from all of this is you're going to be fine. Good luck for your PLAB 2 exam. Good luck for every step of this journey, because it will get easier as you realize with every passing day. You'll look back and you'll think, I can't believe I was stressed out about this. So don't stress out, don't worry. And of course, continue to follow us, subscribe to our YouTube channel, follow us on Instagram, Facebook, and Twitter. You guys can always book personalized guidance sessions with us if you think you want to talk about this a little bit further. And of course, subscribe to our newsletter as well, and we will see you next time. Bye.